welcome Dr. Nathan.
Thank you, guys. I know it's the last lecture of the day. I hate the last lecture of the day. I'm usually sitting by a pool if I'm at a conference, so if anybody kind of loses focus, don't worry. I'm using mainly pictures because you know if you're the last patient, you need pictures. So, I think Hal probably summed up for most of us, healthy diet, but there's a lot of other things that can go into conscious conception. And so a lot of you ask, what is conscious conception? And the problem was, Kara Badgley, my partner, and I, we have been working with autism for many years now. We've watched our own children go into autism, what we call autism remission, where they're not identifiable as such. But we got to talking, and the literature really shows us that we're looking, even as we get these kids and move them through autism to a more life that is more integrated, that we probably are still looking downstream. And there's a great analogy about the waterfall, and this people kept falling over. There was this village that set below the waterfall, and people kept falling over the waterfall. And at first they're like, well, wow, we probably need to post somebody by the waterfall to start pulling people out because these people are falling over. And then the next thing was, well, we probably should put a boat down here and a boat dock so that when people fall over, we'll be even more efficient to go out and get them. And before you know it, they said, well, we probably should have somebody out here even at nighttime, and we'll do it 24 hours. And then the next thing you know, they're like, these people keep falling over the waterfall, and it's kind of a pain in the butt to carry them over to the hospital. Let's put a clinic by the waterfall. And before you know it, we have a small hospital. And you get the point, is that, instead of going upstream, which is really about going upstream and preventing people from falling over the waterfall, we're thinking downstream. And so what better way to think upstream than even before conception? Because the data is there that we can do 10 times more to prevent disease, as far ranging from autism to obesity, to depression. All of these things are connected to the choices a couple makes. And I say the couple because it's not just the mom, and I'll show you why that is, but it's the couple, it's the father. The father plays just as big a role as the mother does, and I think that's really important. And I think as you have babies and you have grandbabies, I think it's more important that we know that 6 months before we conceive is probably the most important time of our child planning career. So, when we look at conscious conception, what we're looking at is a 6-month program where we take people through medical testing. I'll go through what that is. We're going to look at lifestyle, diet, genetics, which is something I'm very fascinated in, and I'll show you some of the genetics that we can look at before conception and make a change in diet and lifestyle and supplements that will carry on to the baby, because so much is turned on and off early on that what you turn on and off in the sperm and the egg actually are transferred to the baby. So we'll see that obesity when you're conceiving actually is passed on to the offspring, and by eating right and exercising, even if you're not ideal weight, you can actually pass on the less likelihood of being obese or developing diabetes. And we'll also look at some supplements. These are sometimes where the rubber hits the road, and I'll show you 4 or 5 that would be helpful. So what are some of the testing we're talking about? Things we're going to look at are insulin, thyroid, heavy metals, vitamin D levels, and genetics. And so insulin, and what we're talking about when we're talking about when people have to go to the fertility clinic, we're already over the waterfall. So when people are going to the fertility clinics, it drives me crazy because when they come to me and they've already been, I said, well, did they check your, these levels? Did they check your mercury? Did they talk to you about diet, of all things? They're like, no, we did Clomid. They start, there's money to be made in procedures. We've heard that from Hal, Dr. Blattman. And I think that's where we're not looking, is that why are we at a fertility clinic in the first place? That's the first question we should ask, is why are we in a fertility clinic? This is not the body's trying to tell us something. Always the body is trying to tell us something. I think, and that's the key, is if you're not getting pregnant, then your body's telling you that your body is not a good host right now. We need to step back and understand that. And probably the biggest thing I see as I work with women and they become fertile is I address insulin resistance. And I've had people that were marathon runners and that were insulin resistant, they were eating incorrectly. And so insulin resistance leads to problems with the eggs. It leads to problems with implantation. So we really need to be looking. So we'll look at your insulin level, and it's not if you're diabetic, it's whether you're actually insulin resistant. And that's where your body is making a decision that it doesn't want any more sugar because it's energy overloaded and it's inflamed. Thyroid, I mean, subclinical thyroid, not in just women, but in men, subclinical thyroid or thyroid that's not being addressed leads to a tremendous amount of problems with infertility, both in men and women. So we need to understand the thyroid in both couples, because this is a huge problem with fertility, and actually understanding what you're looking at with the thyroid, and it's not just TSH. It's actually a lot more to it than that. Mercury is probably one of the issues that's very much passed on to our offspring. Just like chemicals, just like the Roundup, we find so much in the umbilical blood, and mercury is one of those things that decreases sperm counts. We found that actually women before pregnancy and during pregnancy that had heavy metal toxicity, we know that children are going to have at 18 months slowed motor skills. So wouldn't it be great if we knew whether or not someone had mercury before they were born and whether they were going to be exposed to this through the placenta? And yes, it does cross the placenta quite well. And so do we need to remove fillings, mercury fillings? Do we need to understand how we detox so we make sure that this, and this is one of the one of the most toxic, if not the most toxic substance on earth. And we put it in our teeth and we expect it not to go anywhere else. And that's not the case. Vitamin D, what is our vitamin D level? We found that women that were deficient in vitamin D were 4 times less likely in infertility clinics to conceive than women that had enough vitamin D. So something as simple as a vitamin D level as part of our labs can give us great insight into, and the women that did conceive, actually not the women, in another study they did mice, and the mice that did conceive with low vitamin D levels had growth retardation in utero and decreased mentation. So these are just little things. We don't think about it, you know. When we're a young couple, I know I kind of looked at my wife and like, hey, you're cute. That was my preconception counseling. You know, I was like, and she thought I was cute too. And next thing you know, we had a baby, but that's not what we should have done. So what I'm trying to do is go away from the hillbilly method and move more to a scientific method as such. So what's our next step is genetics. I mean, I think now for $99, we can find out not all the genetics that may be out there, but enough to make some good decisions and start working on pathways that we can really make a difference in outcomes, not just in people losing their child for miscarriages or not being able to become fertile at all, but also in healthy babies. And so this is where we can bridge the gap between nutrition and optimized nutrition. We can tell you now what type of diet is going to do better for you than another person. Not everybody's the same. Not everybody's going to do well with paleo. So, you know, when we look at genetics, a lot of people, and it took me a while to understand this as a doctor, what are we talking about when people say MTHFR? And we're talking about mutations in genes. And so mutations in genes, all we're talking about is a gene is the information on DNA that tells your body what protein to make. And usually that's an enzyme. And so when we're making enzymes, if that enzyme's the correct shape, it can do what it's supposed to do. And so it can be a receptor or a hormone, but when you change out one of these, when there is no SNP, and a SNP stands for single nucleotide polymorphism, it just means one base pair is substituted, you may or may not change the shape of that enzyme, which is a 3-dimensional object. And it may be able to keep doing what it's supposed to do, or it may not. And when we talk about gene mutations, that's what we're talking about. We're talking about the enzyme not doing what we want it to do, or it's not doing it as efficiently. So when you hear people say, I've got MTHFR, that's what they're talking about. Their gene that adds methyl group to folate doesn't work as well as it should. And when there's only one copy, so you have two genes, right? So you have one copy, and sometimes you have one copy that works, and then one copy that is not working as efficiently. And so on one side you see that it's able to bind and work as an enzyme to the protein, and the other side has an unusual shape. And if you have both sides, that's sometimes even more decreased function, as I will show you with the MTHFR. If you have both sides, it's a 70% reduction in ability to add that methyl group. And so methylation, we hear this. I'm not going to belabor this. This is a very important pathway, but it gets a little complex. But the big thing to remember, it's a carbon and 3 hydrogens. And methyl groups, this is the methyl pathway. You don't need to memorize this, please. It's very colorful, though. I like it. It makes my presentation look good. I like to know what I'm talking about. But over here, we come to SAMe, and you can see SAMe on this side. And SAMe is what our ultimate goal is with methylation. It's one of the ultimate goals. And that methylation is actually, that's going to donate methyl groups. And why that's important, I'll show you shortly, but we'll look at right now is the one everybody talks about is MTHFR. And people come in all the time and say, Doc, I've got MTHFR. And my sister called me and it's bad. And I said, you know, you and 70% of the other people in this country have MTHFR. It's not a big deal. Okay, so we need to understand that just because you have it doesn't mean it's going to affect you, and that it's easily worked around. So MTHFR, we do know though that this gene plays a big role in our ability, if we're not addressing it, and we do have a homozygous, we have a 70% reduction in efficacy of this gene. And so we have a 70% reduction in that ability to add a methyl group to different compounds, such as homocysteine. We add a methyl group to it, it becomes non-toxic. It becomes methionine. So homocysteine is neurotoxic to the brain. Dopamine, we add a methyl group to it, and now we've got methyl dopamine, and we're not wired as much anymore. We're not as anxious. So that helps us detoxify our neurotransmitters. And we turn on and off genes with this methyl group. So this methyl group becomes really important, especially when we're talking about an egg or a sperm. We're talking about genes and the ability to pass on those genes, and whether those genes are turned on and off, whether those genes are repaired or not repaired appropriately, depends on methyl groups. So really what we're talking about with methylation is the ability to repair DNA, to detoxify, and help develop the appropriate neurological development. So it takes on a really big role. Another important SNPs that we'll be looking at, this is not all of them, there's a tremendous amount that we look at, but one of them is the GC protein. You'll see there, that's the vitamin D carrier protein. That's why some people need 5,000 to 10,000 units of vitamin D, because if you have this SNP, this is the reason why people can't get their serum levels above 20 and 30 a lot of times. And then you'll see these SNPs over to the side, which are vitamin A. Vitamin A, a lot of people say, oh, I eat a lot of beta carotene. But beta carotene has to turn into retinol to be effective and do its job, especially with eye development and immune health. So it'd be really important for eye development and immune development of the fetus to know if you have enough vitamin A. It's one of those missing vitamins we don't talk about enough, but I find it's very, very helpful. And I had a 35-year-old lady who was attempting to become pregnant, and she said, I'm doing cod liver oil, I'm getting all the vitamin D and vitamin A I need. And we were able to look at this SNP, and I was able to find that she was both low on vitamin D, even though she was supplementing. So we did 5,000 units of vitamin D for her, and her vitamin A was also low because of her genetics. So we were able to look and understand because of her genetics that I could identify, hey, I probably need to get levels on you and see before you get pregnant how these levels, because these are going to have a huge, as we've already talked about with vitamin D, your chances are going to increase greatly if we can get your vitamin D where it needs to be, and the baby's neurodevelopment is going to be very much affected by your vitamin A status. So once again, we've got some things we never had before to help us decide what we want to, how we want to intervene before pregnancy even occurs. So this is vitamin D binding protein. We make vitamin D, but there's actually a protein that delivers it to the cells. And so that's where we can determine, and this is one that's looked at with your 23andMe, $99, and we can run it through Pure Genomics, and all of a sudden we know whether this is something, and this is genetic information for the rest of your life. Shows that if you had two enzymes that didn't function correctly, remember the homozygous or two enzymes that didn't work correctly, you were more likely to have serum levels below 20 nanograms per milliliter, which is really low. So this is something we're going to say, hey, this person probably needs at least 10,000 units a day, and then we'd keep an eye on it. And you can see that it really compromised the benefit from sunlight in northern latitudes. So really important that we look at that. Who is affected with these? About 60% of American Caucasians. So it does depend on the ethnicity, how these genetic SNPs penetrate, but most Caucasians have a real problem with vitamin A. This is the vitamin A SNPs, and at least 20% of Asians. And so vitamin A is made, and how it works, we go from, you don't have to memorize this slide either, another makes me look smart slide, but you can see that vitamin A, the big thing I wanted to point out is the gene regulation at the bottom, and it's got developmental pathways. It's very important. Retinal health, immune cell function, cell cycle checkpoints, and cell differentiation. And those things are very important as we make a fetus. And so I think vitamin A status plays a big role. And these are some of the things we're going to do in our 6-month program, is make sure these things are being addressed. Weight management, how many people just think, well, nothing works for me, and we tried the paleo and actually we gain weight and everybody else is losing weight. Why do some of us have more of an appetite than others? And that red FTO is one of the best studied genetic mutations out there, and it shows that you're going to have problems with satiety, and you're going to have problems with increased appetite and wanting to eat more often. And then there's one that's going to show problems with glucose, the ADPO-Q. And then there's the ApoA2, which means that if you eat more than 22 grams of saturated fat a day, you're going to gain weight. And sometimes low-fat diet, actually, I used to say, oh, everybody's okay with doing the paleo, everybody's okay with doing a higher fat diet, healthy fats, it's all good. But actually we find that some people don't do as well, and they actually gain weight, and they actually become more insulin resistant. So we need to understand these things so we can make good choices. Fortunately, the FTO is about 15% in the population, but when you have it, then it really is, it changes the whole paradigm of how you treat weight and insulin resistance. So knowing these things are helpful. Here's one that shows if you have this particular mutation, you can't take things like flaxseed and other omega-3s and turn them into EPA and DHA. And DHA is one of the more important factors in brain development. So we know if we have this one that we definitely want to make sure we don't depend on flaxseed and things like that to get people to the EPA, DHA they need. So this is going to be important in development of a fetus. Let's talk about epigenetics. I think, we hear genetics and we feel like we're a victim, but we're really not. Genes are turned on and off a lot, and the things that are positive for gene being turned on and off are called epigenetics. And it can be both positive and negative, but the biggest thing is, of course, exercise. We've shown this over and over again. Epigenetics are determined greatly by exercise, and whether it's interval training or just walking, all of these things have shown improvement in the epigenetics. I think the biggest thing we've seen is interval training. But we do interval training, we actually turn on almost 400 new genes that are for our health. And so I think that's probably the most bang for our buck. And so we will talk about, through conscious conception, what kind of exercise a person needs to do. How do they start that? Healthy diet, I think we've heard that over and over and over again, but healthy diet, not just your fascia, not just for cancer, but it really is about turning your epigenetics on and off, and in that way it does affect those things I just mentioned. So healthy diet is really important, and that's one of the big things we're going to spend a lot of our time through Conscious Conception doing, is discussing what is healthy diet and what does that mean actually. And so I wanted to show you with epigenetics that in men, this is in obese men, a study showed that alteration in preconception diet or exercise interventions in obese fathers resulted in normalization of RNA profiles. And RNA profiles means that they didn't get skinny during this study. They just exercised and they dieted correctly, and they changed their whole DNA so that now the messengers that they were sending out, messenger RNA, which makes proteins, completely changed and they normalized. So that's why 6 months is so important, because we have to do diet and exercise for 3 months, and then you've got to give the sperm about 3 months turnaround time. All right, so it takes about 90 days to get a whole new set of sperm, so that's why 6 months becomes really important. And so we can see that this is epigenetics. That's what I'm talking about, changing diet and lifestyle. We changed actually how their DNA presented. Didn't change their DNA, but just changed how it was interpreted. And there is evidence, in addition to the immediate effects that obesity has on the father, there's evidence that negative effects may be transmitted to the offspring via genetic and epigenetic alterations of germ cell DNA. And so we're talking about generations. And I think that's what's important here, is that we're not just talking about our baby, our grandbabies. Sometimes this goes on for 7 generations, and we've seen this in rats, that they've had the same identical rats, and they made one obese through its diet and the other was not. And 7 generations later, the obese rat, they were still having obese offspring. So if we could change our diet and our exercise and our methylation before we ever become pregnant, then we're changing generations. And that's where this gets exciting. We're really getting far upstream now, right? We're not at the waterfall. We're not at the infertility clinic, or we're not postpartum depression. All these things are way downstream. We're talking about generations from now. Making choices are going to affect our great-grandchildren and on. And that sometimes all we have to do is make changes for 6 months, and we can make huge savings for our healthcare system and our, and our medical system. And so here's a fun chart, not to be memorized, but it just shows you all the potential mechanisms that go into this: stress, inflammation, sleep apnea. We won't even go there. That's a big piece of the puzzle. But you can see over in the epigenetics, alteration in fertility, how epigenetics plays a huge role in that on your right side. And so one last thing, therefore, even if fertility issues can be overcome in obese patients, additional consideration should be given to potentially unfit gametes resulting from exposure to the testicular environment seen in obese men. So even if we can get pregnant, doesn't always mean that it's a great thing, because we're going to pass on a lot of those problems to our offspring. So just because someone gets pregnant doesn't mean it's always a healthy pregnancy. So I think it's really important to understand that we're changing. When we talk about the egg and the sperm, that's really being determined by the choices we've made the 6 months before we get pregnant. So let's talk a little bit about folate, 5,000. This is one of the higher doses of folate, but folate is the 5-methytetrahydrofolate gets around that SNP that I was talking about earlier, the MTHFR, that a lot of people tend to have. But you just take 1,000 milligrams and you'll usually get around it, and you don't have to worry about the side effects of it. And that's the problem with most of our our prenatal vitamins, is they have folic acid, which is synthetic, which has to go through about 5 or 6 steps before it comes 5-methytetrahydrofolate. And we know that actually supplementing with methytetrahydrofolate is a lot better, especially with this mutation, and we've seen that. And you can see that even with people that don't have the mutation that I was talking about, giving them 5-methytetrahydrofolate actually they accumulated, even if they didn't have the mutation, they had superior assimilation in their red blood cells. So really, it will never hurt, and to make sure your prenatal has that would be very important. Homocysteine, when we talk about methylation, what we're really talking about too is the ability to utilize homocysteine to make SAMe, but if it builds up, it's neurotoxic. It decreases fertility. So this is another thing we'll be checking for is homocysteine, but homocysteine is best addressed with folate, B6, and B12, all of the things in that methylation cycle. So homocysteine is just a byproduct of that methylation cycle, but when we see it build up, we know that that cycle's not working like it should, so we need to understand if that's high, then we probably are not supplementing correctly, and that we're going to have to change our approach. Magnesium, this is the the Swiss Army knife, I call it. Everybody needs to be on magnesium. We're all deficient in magnesium. It works for hypertension. It works for insulin resistance. And the thing I really think is important, it takes about 6 to 9 months to really get your magnesium levels replete. And most postpartum depression and depression during pregnancy is magnesium depletion. So the data is there to show that also gestational diabetes, very well addressed with magnesium. So wouldn't it be great to be on magnesium 6 months before? And preeclampsia, which is high blood pressure during pregnancy and at time of delivery, can be prevented with magnesium for about 30 cents a day. Pretty big deal. Pretty big deal and very easy. I mean, we just, you know, it works for cardiovascular disease, it works for blood pressure. I think everybody in this country is somewhat deficient, and it's just not in our soul, and the way we test for it is not correct, so, you know, this is really important. Vitamin D, I've mentioned vitamin D. You've seen vitamin D a lot, and I'll tell you why. Vitamin D is a big prevention for autism. And I read a study that was, and Kara's heard me talk about this study, but I think everybody should know that they did a study where they gave women 6 months before pregnancy 5,000 units, and then during pregnancy they gave them 5,000 units, and then after pregnancy and they were breastfeeding, they gave both the infant and the mother vitamin D. And women that had autistic children previously have a 20% increased risk of having another autistic child. But when they did 5,000 units of vitamin D, as I mentioned, they decreased that risk 300%, from 20% to 5%. That's a 300% reduction in something that's going to cost that mother at most about $100 for the whole, before pregnancy, during pregnancy, and afterwards. We're talking $100. And if it was a medicine and we had that kind of data, they would charge $3,000 a month. And I'm just going to tell you, it's just what is going to happen. Because if you look at, let's say we prevent one case of autism, just one case, that's a $1.3 million savings to society. If they have a learning disability, this is a Harvard study, they have a $2.4 million debt that's going to cost society to help get that child taken care of in their lifetime. So we're talking about $100 or 1.3 or 2.4. And I think just a little bit of vitamin D, that's really going upstream. And that's really going to keep us from building the hospitals. So let's talk about DHA. DHA is another great supplement. Actually, it is the part, you hear EPA, DHA. This is the omega-3 that really is involved in nerve development and brain development. And they showed that women that were on DHA both before pregnancy, during pregnancy, and while they were breastfeeding, there was a 10-point difference in IQ in the offspring. And that's huge, guys. It's the difference, you know, in a lot of things in life. So if we could, once again, 30, 40 cents a day. You know, we're not talking about expensive. So we're talking about prevention. Yeah, it costs a little money up front, but if we can address these things, understand that a $99 genetic test that's spending $2 or $3 a day on some supplements that are going to improve our chances of getting pregnant but also having healthy babies, I think it's well worth it. And that's what I was talking about with the brain. I mean, the brain, so important. And so many times we don't focus on what's in the breast milk. And so detoxing someone also before, that's another thing we're going to focus on is detoxing. What is in the breast milk? Are we letting heavy metals in the breast milk? What are we passing through the placenta? Is it good things like DHA or is it things like mercury? So then we talk about lifestyle. I mean, how many times do y'all have to hear it today? I think y'all got it. Y'all been beat about the head and neck with lifestyle. You know, I think we all want to pick the apple, although that donut looks mighty fine. Yeah, it does look good. Toward the end of the day, you're tired. Everybody wants that donut. So, and if there ever is an asteroid, I'll just let y'all know. If y'all want to find me, if there's ever an asteroid coming, everybody else will be running around being crazy. I'm going to be at Dunkin' Donuts eating those and milk. I'm going to have them both because I've been gluten-free. I'll just be in a coma. Just let it hit. And if it misses us, I'm in real trouble because I don't do well. So another thing we want to talk about besides just diet is our parenting styles. I think this is a thing that's overlooked a lot of times is parenting styles. And before someone ever becomes pregnant, I think we need to have a coaching through the parenting styles because we know that traumatic childhood experiences have a direct effect on depression, anxiety, later in life obesity, coronary artery disease. And wouldn't it be great before the baby gets here to know how you were going to approach it? Because we all were raised in different houses. And so we all have different thoughts on how parenting should be done. But I think if we can start that discussion before we ever get pregnant, and we can work through that before the child gets here, and so we don't have these traumatic childhood experiences, and that can involve watching the parents fight, divorce, actual verbal abuse to the child. The list goes on, and there's 7 big ones, and we know that the more of those accumulate, the more troubles we're going to have, and the more troubles later in life they're going to have. So if we really want to get upstream of that, we need to talk about how we parent. We need to talk about money because when you get pregnant, nobody shows up like this, do they? It's actually the other guy coming. It's like the tax collector's coming because they're going to be taking, that's the money they just took out of your pocket is what's happened when you get pregnant. So if you want to keep a lot of money, don't get pregnant. That's my thing. But it's wonderful. I have 4 kids of my own, but we need to talk about financial planning. So we need to understand what are we going to do with this? Because a lot of the fights, the previous trauma that we're talking about, a lot of things happen because of money and how we manage money and the different styles. And so that's another thing in conscious conception we're going to work with parents on is how do you budget? How do you plan? What are you going to do with your money and so that everybody's in agreement before the child ever gets there and we understand what's important and what's not. Trauma, we just talked about trauma, but I think understanding emotional trauma from our past is one of the things we want to talk about because getting pregnant and having birth is a traumatic event. And so we want to make sure that the mother and the father both have cleared those things so that they can be better parents. So I think working through emotional trauma is very important before we give birth. So hopefully I've kept this presentation relatively short for you today so we can, and our brains didn't have to think too much. The conscious conception model is something that we'll be putting in place in September where we'll be doing signing up in June. But it's going to be where we put in a plan where we can talk about the things, the medical testing, understanding what the thyroid is, understanding what detox we're doing. Do we have mercury? What is our lifestyle choices that we're making? What is the foods that we're eating? What are the genetics that may hold us up from having an ideal pregnancy or an ideal conception? And what supplements should I just be on as a preventative for problems in the future? Something as simple as vitamin D and how important that is. And that's just our hope is that we really get upstream. We desperately want to get upstream. As I've worked with children in the spectrum, and I've worked with people as far upstream as obesity and these sort of things, wouldn't it be great if we could have reached them way before then and done something that we don't have to put so much effort in and they've had a much more fulfilling life because of thinking before they were ever conceived. So thank you very much, and I appreciate y'all's time.